Welcome again to our series of essays in physiology as we write an essay on pulmonary compliance. I'll be walking you through with this outline as I discuss this essay word for word. Introduction, factors that affect pulmonary compliance, the role of pulmonary surfactants and clinicals. Now, what will be my introduction? My introduction should simply be my definition. And I'm going to define pulmonary compliance as the degree of stretchability, the degree of stretchability of the lungs and the rib cage, of stretchability, the degree of stretchability of the lungs and the chest wall, okay, or the chest cavity. So that degree where the lungs and the chest wall can stretch themselves is what we call compliance. Or some people have defined it as the volume per unit pressure. Volume per unit pressure. All right. Now we've been able to appreciate that if you have a definition, maybe choose one of these definitions and put that down. That introduces the concept of pulmonary compliance. What about the factors that affect pulmonary compliance? So the factors that affect pulmonary compliance, you remember it with a P, an L, an A, and a DD. Now let me decode it simply for you. For the P, it stands for posture. For the P, it stands for posture. For the A, it stands for the L first. L stands for the lung volume. Lung volume. Now for the A should stand for alveolar surface tension. Alveolar surface tension. Okay. While D should stand for diseases, and the other D should be for diseases of the thoracic cavity. So diseases in particular, and then the other D should stand for disease of the thoracic cavity. Disease of the thoracic cavity. All right, now let's explain each of them. Let's begin with the first one, posture. So for posture here, I would say that first off, that when we are standing in the supine position, what happens? And when we are standing in the erect posture. Now let me draw a prototype man. Now look at something here. We have a prototype trunk of a man. This is the head and then the legs. This is a prototype man. And then I have the diaphragm like this. And then somewhere here, I have two lungs, something like this, something like this. These are abdominal contents. Now, if this man stands erect, normally this diaphragm will pull down. And we are going to have our diaphragm somewhere like this on a erect posture. So, and it means that the diameter is going to extend something like this. See how much the diameter is now, unlike when it was something like this. So this has increased the volume or the, let's say, the vertical diameter of the thoracic cavity, and you can tell that will increase compliance. So in the erect posture, due to gravity, this is going to cause an increase in compliance, as illustrated by what I showed you here. That during gravity, what happens is that the diaphragm, due to gravity, everything pulls down, and this increases the diameter of our lung cavity or of the thoracic cavity. While on the other hand, during supine posture, when we lie flat, the reverse of this happens. Abdominal contents will push through into the thoracic cavity via the underlying surface of the diaphragm. This will reduce the diameter that we see inside the thoracic cavity, and that is going to cause a fall in compliance. So that is what I wanted you to know. All right. Now, for that of lung volume, it is directly proportional. Lung volume is directly proportional to compliance. Okay, so compliance is directly proportional to lung volume. So this means that as we increase lung volume, there's increase in compliance. As we decrease lung volume, there's a decrease in compliance. Now, after I'll leave out this first, I'll come back. Now, let me explain this too. For thoracic cavity disease, the most common example here is kyphoscoliosis. Kyphoscoliosis. Now, with kyphoscoliosis, these people have the thoracic cavity has a problem to easily open up and close. That means that ability to have the pump handle, the bucket handle, and what have you is distorted. The integrity of that is distorted, making it difficult for easily stretchability. So, diseases of the thoracic cavity will reduce compliance. Okay. Now, how about normal diseases? Let me list out some of the diseases that I want to mention. Some diseases could increase compliance, some could increase it. Give example. Example here we have emphysema. Emphysema. Okay. We also have pulmonary congestion. Pulmonary congestion. We also have the likes of the interstitial fibrosis. These are examples of conditions that affect compliance. Now, for the first one here, which is emphysema, what emphysema will do, emphysema happens to be, let me give you an example. This is the alveoli here. If the alveoli remains quite distended, quite dilated, because probably of an absence of an enzyme called alpha-1 antitrypsin. Alpha-1 antitrypsin has been implicated in people with emphysema. So the lungs just remain so stretchable, so distended, so compliant. So these would increase compliance. A disease like this will increase. But how about pulmonary congestion? Pulmonary congestion, what happens there is that the outside of the lungs is filled with fluid. All right. But even inside the lungs itself, the alveoli is should becoming difficult to stretch as it should. So this will decrease it. Likewise, even with interstitial fibrosis. So I've been able to explain these four. I will discuss alveolar surface tension on this one. So for alveolar surface tension, the first thing you are going to say is that this is dependent on surfactant. And surfactant is the most important of all these factors that affect compliance. And that is why you now have to go and discuss the role of pulmonary surfactant. All right. Now let's recap that again and then we end the picture. So let's talk about the role of pulmonary surfactants and we go. The role of pulmonary surfactants and we end our picture now. Now for the role of pulmonary surfactants, I think I need to say something quickly that you have to add a few important introductory words there. That number one, surfactant is produced by type 2 alveolar cells. It is produced by type 2 alveolar cells. It is released by exocytosis. It is released by exocytosis. Okay. Now for the functions of surfactant, now let me see if I can show you how the alveoli looks like. What surfactant does in that, it puts the whole surface like this. So it prevents the collapse of our alveoli. So what are the functions or the role of surfactant? Number one, it helps this to be stable. Surfactant stabilizes the alveoli. Number two, what will surfactant do? Remember, it has stabilizing. Number two, surfactant has the ability to increase the alveolar radius. It increases alveolar radius. Number three, surfactant plays a function in surface tension. So because of its function in surface tension, it is going to, by the way, it reduces surface tension and this is going to increase compliance. This increases compliance. And then number four, because of surfactants here, some substances cannot enter here and stay in the alveoli. So it helps to maintains the pulmonary integrity. I think I would have you to put it that way. Because if this was not possible, it's possible to have edema infiltrate. Edema infiltrates from edema. All right. So those are things that I want you to note about the functions of surfactants. Now, how about important clinical source of surfactant? The most common is what we call the atelectasis. Atelectasis happens to be when there is a collapse of the alveoli. When the alveoli collapse, we call that condition atelectasis, and that is when there is a fall in compliance. How about when a person does not produce surfactants? We're going to have a problem called infant respiratory distress syndrome. Infant respiratory distress syndrome. All right. So this one, the child is born prematurely around weeks 28 to 32, when we have not been fully producing surfactant and his lungs easily collapse and the baby has a difficulty in breathing. And in this condition, what happens? The baby is going to be on support or thereabout. All right. So it's quite necessary you look at for your clinic as atelectasis, infant respiratory distress syndrome. Even in adults, it can present and then called adult respiratory distress syndrome. Okay. So this has been an essay on pulmonary compliance, and I really do hope it made the most sense to you. Thank you.